A very common complaint that I see in my Houston podiatry practice is edema, which is swelling of the feet, ankles, and legs. Not all swelling is created equal, however. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. It's important to identify the cause of the swelling. That will help to determine when it's dangerous, when it's something you can treat at home, and when you need to get it checked. In today's video, I'm going to discuss the causes of edema, how to treat them, and when it's important for you to visit your podiatrist. But before I do, let others know about these videos. Please like, comment, share on social media, and hit the subscribe button so you don't miss a new video. The number one cause of swelling in your feet, ankles, or legs is your overall health. That's a big umbrella. Let me break it down. Swelling can be caused by heart problems such as congestive heart failure or previous heart attacks. Lung issues such as COPD, smoking, and emphysema. These cause a strain on your heart which becomes less efficient. It can't pump all the fluid through and settles down into your feet. Kidney issues can cause swelling. Long-term diabetes and other metabolic issues. You can swell if you're severely overweight because of the extra work your heart has to do to pump the fluid through the body. If you have any of these issues, it's essential that you get them checked by your podiatrist, your internist, or your cardiologist. Another cause of edema is pregnancy. Pregnancy messes with your metabolic system and fluid control. You have to cycle more fluid than you're used to, but your heart is the same size. That will lead to swelling. This is very commonly seen in pregnant women, especially as the pregnancy progresses. The next cause of edema is a pretty dangerous one. It's called lymphedema. This presents as a harder form of edema. The outer layers of the skin thicken and become scaled. Your legs may resemble tree bark. Scary, right? The lymphatic vessels function to drain the fluid and proteins from surrounding cells and carry them upstream to get them reincorporated back into the bloodstream. If the lymphatic vessels are damaged, it can lead to lymphedema. You can damage the lymphatic vessels by being overweight for an extended period of time. Skin infections such as cellulitis and physical injuries as well. These injuries to the vessels can create the thicker skin and associated swelling. This is different from vein issues that cause swelling. Venous stasis, venous insufficiency, and varicose veins are also causes of swelling of the foot, ankle, and leg. In these cases, the veins work to bring the blood up the leg against gravity. The veins have one-way valves that prevent the blood from moving backwards. What can happen, though, is the valves can fail, causing the blood to leak back down the leg. The swelling from venous issues is different from lymphedema. Lymphedema causes a hard, brawny type of swelling. Venous issues cause a type of edema called pitting edema. Pitting edema gets its name for the indentation that's left when you press on the area of swelling. It's almost like putting your finger into putty. One great home remedy that can be used for edema caused by venous issues is using a pneumatic pump. These are boots that you put on when your feet are propped up. They progressively compress from your feet to your ankles and up your leg. These pneumatic boots do a great job managing edema. There are some consumer units, but I find the medical grade ones work a bit better. Edema can also be caused by infection, either fungal or bacteria. Look for open wounds, redness, itching, and tingling. This often affects one limb only. In some cases, it's treated with an oral antibiotic. Some medication can cause swelling in the lower extremity. This is particularly true for heart and blood pressure medication. It's a known side effect of the medication, to the point where it's formulated with a diuretic in the medication already to help offset the known swelling. A blood clot can form in the calf. It's called the deep vein thrombosis, or DVT. If your calf becomes red, hot, and swollen, it may be a DVT. If you've recently taken a long plane trip or had foot or ankle surgery, It may be a DVT. If you had a severe injury like a broken ankle or hip, you might form a DVT. A DVT is a medical emergency. It's important to go to the emergency room and you'll likely be admitted into the hospital. The test that you get is a venous Doppler, which is a non-invasive test to look for blood clots in the vein. The reason it's important to identify and treat a DVT is because it can dislodge, travel up the vein, and become a pulmonary embolism. That will affect your breathing and is a life-threatening issue. There are musculoskeletal issues that also cause edema. Wearing an unsupported shoe when you exercise can cause the muscles and tendons to work too hard. This can cause them to swell and lead to edema. Wearing a shoe that has more support will support the muscles and will help to prevent them from becoming inflamed. If a supportive shoe isn't enough, then you should consider an insole or a custom orthotic. That will provide more support for the foot and ankle. It will allow the lower extremity to work more efficiently and minimizes the chances of the foot or ankle collapsing and needing more energy to move you forward. This takes pressure off of the muscles and tendons and prevents edema that otherwise would be caused by it. Mobilizing the muscles is helpful to prevent or treat edema caused by musculoskeletal issues. You can roll your foot on a frozen water bottle. You can use a tennis or lacrosse ball at any point during the day. You can use a massage stick or foam roller to work on your calf, quads, and hamstrings. This helps to calm down the muscle inflammation and helps with the blood flow as well. Then you should stretch. Stretch your calf, your thighs, and your hamstrings. It's simple to stretch against the wall or by using a towel to pull back on your foot to get a good stretch. Think about putting creams and ointments on your legs. They help, but massaging them really helps. You can use an analgesic like Biofreeze or a CBD cream. You can use an anti-inflammatory gel like Voltaren gel. You can use any cream with essential oils. Again, rubbing it in is what's going to help with the swelling. Anti-inflammatory medication may help edema caused by musculoskeletal issues, but not so much swelling caused by other causes. It shouldn't be your first consideration. Finally, you may need to change your habits. If you're constantly standing at work, I can give you a note to allow you to sit periodically throughout the day. If you have a biomechanical imbalance that's causing your muscles and tendons to work too hard, we can work with insoles, orthotics, and braces to help to stabilize your gait. This is a simple way to calm down the soft tissue and prevent swelling. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're fighting edema and don't know the cause, come into the office and we will either take care of you here or direct you to the right doctor to take care of you. That link to schedule is in the description. Thanks so much for watching and have a great day.